What is IPC? Individualized Pediatric Cure. Sure, but what does that really mean? Cancer in children is, in many respects, more complex than in adults. In the struggle to save those little lives, clinicians may have to fall back on treatments designed for adult cancer types to win the race against time. Oftentimes, these aggressive treatments lead to severe side effects. Wouldn't it be great to have personalized treatment strategies so unique that they fit the child perfectly while minimizing side effects? IPC will introduce modern technology to find the most promising treatment options for children with cancer, making it personalized, effective, and timely. And how do we do it? We create a virtual patient, or avatar, which is a faithful representation of the patient based on their individual molecular and clinical makeup. When working with real patients, there's no room for trial and error, but an avatar allows for large-scale testing and quickly gives clinicians much-needed feedback. Secondly, IPC project partners will develop and integrate computerized mechanisms to scan tons of medical information and extract just the useful data. What could take someone years to read and analyze could be available in just moments thanks to artificial intelligence and high-performance computing platforms. When this data is used in conjunction with the avatar, clinicians have a fighting chance at offering a tailored treatment plan. So what is IPC? It's a challenge. It's personalized treatment that revolutionizes the way children are taken care of. It's hope for the kids who need it the most. Be sure to check out our website and stay up to date by following us on social media.